Senator Brosen.
Well, good morning, everyone. Thank you, Senator Collins, Ranking Member Casey, for holding this important hearing. And of course, like Senator Scott said, for the impressive group of panelists who have spent so much of their life and efforts on healthcare in so many areas, and particularly this one. But I want to address the racial health disparities and how we can work through education, training, and resources to make things better, because racial and ethnic health disparities, they persist because of long-standing inequities in working, living, health, and social conditions. We see the manifestations of such disparities everywhere. For example, during COVID-19, data from my home state and the Southern Nevada Health District shows that Latinos are dying at a higher rate than any other group in the region. In Northern Nevada, the Latino population has the highest number of COVID-19 cases in Washoe County, even though the Latinos only make up a quarter of the county's total population. So, of course, we know too often inadequate access to care, underlying biases place ethnic and racial minorities, and especially seniors of color, at greater risk of complications due to COVID-19, of course, and other diseases as well. So research also suggests that provider actions can be influenced by implicit biases, which impact the delivery of overall medical care, sometimes without medical providers even realizing it. I'm glad to see that the University of Nevada Reno Sanford Center for Aging is taking the steps to combat the impact of implicit racial bias by requiring staff to attend trainings on the subject. The Sanford Center is also taking steps to review both its internal policies and the gerontology academic program curriculum overall to ensure that they include economic, social, and policy content that address the impact of racial disparities. So to Doctors Mack and Carnathan, as both researchers and educators, how can we best train our medical students, and in fact, all of our medical professionals, to identify and understand their own implicit biases so that they can recognize how this contributes to their decision-making and delivery of care? And what types of practices do you think are worth us investing in to be overall success, to make the most success? And so let's start with Dr. Mack, and then we can go to Dr. Carnathan, please.
Thank you. Well, when we consider the practicing, and we've always focused on the importance of primary care and the behavioral health component that it actually highlights within primary care, and that's what we're talking about. There's a larger aspect to the training, which should provide the sensitivity of the student to the total patient and the healthcare of the patient. We realize that only 20 to 25% of your health is contributed to healthcare. So it's very important that we take in consideration those social economic determinants. And that includes the bias of physicians, the bias of the health system when it comes to treating patients. So that has to be put into the curriculum. It has to be expressed in the training, whether it's in the ambulatory setting or it's in the hospital. And some of that training means we have to train the trainers. Educators have to be aware of the biases. And while the student is shadowing them, they have to also make sure that they're addressing that. So I think we have to make sure it's in the curriculum, it's taught on the wards, but also that the academians, including myself, professors, associates, et cetera, are aware and are properly trained to train the students properly to be aware of those biases.
Thank you. Dr. Carnathan, please.
Thank you for this opportunity. These are discussions that we are actively having right now at our medical school about how best to incorporate these critical skills in the ways in which we teach our clinicians to treat patients and how to interact with them. My experience in the educational field suggests that experiential learning is one way to really cement the lessons that are out there. I think that the ability for medical students in training to actually hear directly from patients, the ability to hold panels or even invite community members to share their experiences, providing recordings so that healthcare providers can hear the very subtle language that they may use that does seem to imply that the problem lies with the patient. Consider the example of managing somebody with diabetes to say, you need to eat more fresh fruits and vegetables. To hear directly from a community member about how difficult it is for them to access those fresh fruits and vegetables in the neighborhoods where they live may help to guide the ways in which they hold conversations with patients. And so I think this content, it should be required, and I think experiential learning is an excellent technique in order to train medical providers on how to best pay attention to these factors.
Well, thank you. I appreciate that. I do agree the way that we listen and respond and the way that we offer advice, all of us can learn from those kinds of conversations. I appreciate that. And thank you, Senator Collins.